I spoke about the promise of artificial intelligence and the fact that we think about artificial intelligence as making healthcare better, but the reality is that we're running out of people to do the work. And artificial intelligence gives us the first kinds of technology that we can really use to substitute for some of the tasks that our caregivers and people in healthcare do, allowing us to extend the reach of our professionals and actually make care accessible in an environment where we're really going to be facing critical shortages. Well, healthcare continues to be focused on becoming more accessible and affordable and effective all at the same time. What we're recognizing, however, is that if we do it the way we always did it, through caregivers who are well-meaning, we're never going to be able to get what we need to get done. So we really are thinking about the concept of humans and machines working together, technology and people working together, not to replace what people do, but really to extend their reach and their capability. For example, access is a problem we can solve if we can extend the number of caregivers, otherwise we have a tremendous shortage. At the same time, we talk about concepts like equity, or we talk about concepts like healthcare outcomes for people. Well, we know that if we don't use digital technology to scale our expertise, there are many people who will simply go unserved or get the quality of care that's only available in their geography when we know that care might be available someplace outside of the locations they live in. And this is all part of what we can do with the combination of humans and technology together. We're still, relatively speaking, early in the journey. We're still mostly dependent on people, but we have been making progress. However, what we've seen in our own research is that the rate of adoption of digital technologies by citizens is starting to slow down and actually even out. And it appears to be related to three things. First and most importantly, people don't trust who has their data. And if they don't trust who has their data, they're not willing to share it. The second is if they have a bad digital experience, they don't necessarily come back and do it again. Right. And the third is it has to fit in the way the doctors are working. They won't do something on the side. That's one thing the pandemic has done, is it caused doctors to start using technology because there was no other way to see people. And that forced adoption was a positive experience for doctors and for patients. Well, one of the really interesting examples is something we call hospital at home. The idea that somebody who really needs to be in a hospital can be cared for in their home. And the way we do that is by providing enough technology at home to provide continuous oversight. And then we still send people to the home. The doctor comes to the home to visit. Nurses are there 6 hours or 8 hours a day. However, we have demonstrated that we can safely take care of anywhere between 10 and 30% of the people that are filling hospital beds today. That means we don't have to spend the money to build more beds, but we can still take care of sick people. That's a fantastic example of how we can use technology to extend our reach. For sure, patients have a preference to be taken care of where they're at. And in some cases, it's actually safer at home. For example, you can get an infection in a hospital from another patient that you might not get in your own home. It's all about finding the right example. Not every patient can be safely taken care of at home. Sometimes the team needs to be together in person. Sometimes the equipment is too big or too expensive to take to the home. But if we think about trying to make care as location independent as possible, that gives us the most amount of options. Well, increasingly, citizens are aware that their data is available. In fact, COVID heightened that concern because people realize that even your physical location can be tracked, and if you don't know it, it might violate your sense of privacy. And so what's happening is this recognition that we have to solve the problems of healthcare and digital technology while respecting the fact that people really want their information shared on their own terms. That is going to require more sophisticated approaches to consent and transparency, but it's a solvable problem. What's happening now is the technology got ahead of what people's experiences were. Now that people are having experiences, they're seeing both the positive and the negative that can come with information that is emitted by their location, their body, all sorts of things. And they want the benefit, but they also want control over who has the information. And increasingly, they're even concerned about whether or not the company that has their information is a company that they can fundamentally trust. Well, I think one of the things that we're seeing really clearly now is it's becoming harder and harder to separate business from technology. We often talk about this idea that digital technology is pervasive. We're in a post-digital world. This is a place where you can't escape the fact that we don't know where the line for business ends and the line for technology begins. What's particularly good about Mobile World Congress this year and these various events like the healthcare event is it shows the cross-sector ability to learn. So one industry learns by looking at another industry and then takes, by analogy, lessons learned and moves it over to solve their problem. So rather than thinking about the world just in a kind of a horizontal technology way, we're thinking about the uses, but by seeing all the different uses next to each other, we see a new set of opportunities.